Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo. We have a unique show for you this evening. We're talking about neuromuscular medicine at St. Luke's University Health Network. Tonight, we will be joined by a talented panel of experts from the field. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at neuromuscular medicine offered at St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Dr. Devisha Rahija, a board-certified neurologist with additional training in EMG and neuromuscular medicine. She earned her medical degree at Government Medical College in India, completed her neurology residency at Drexel University College of Medicine, and her fellowship at Penn State Hershey Medical Center. Dr. Rahija's practice focuses on patients with neuromuscular disorders and has a special interest in patients with ALS, also known as Lou Gehrig's disease. Thanks for being here, Dr. Rahija.
Thank you for having me here today.
So tell me how you became interested in the field of neurology and what gives you the most satisfaction in what you do.
I had the opportunity to train at one of the oldest medical schools in North India, and from the day one I always saw neurology as a fascinating field. I always found the complexity of nervous system fascinating and intriguing, how everything is connected from the brain and spinal cord, and how the brain as the master organ controls the whole body. Most neurological diseases come with a lot of disability and have a huge impact on patients and their families. And it's great to be a part of their journeys together.
That's amazing. Thanks again for being here. Joining our panel next is Dr. Stephen Lovett. Dr. Lovett completed his medical degree, neurology residency, and fellowship in neuromuscular disease at Baylor College of Medicine. He's board certified in neurology and neuromuscular medicine. His areas of expertise include electromyography, performance and interpretation of muscle and nerve biopsies, neuromuscular disease, and neurological disease during pregnancy. Dr. Lovett, thanks for being here.
Thank you for having us.
Tell us a little bit more about neuromuscular medicine and how it relates to the various conditions you might see in neurology.
So neuromuscular medicine refers to conditions involving parts of the nervous system outside of the spinal cord. So the nerve roots, the nerves, the connection between the nerve and muscle, that's what we refer to as neuromuscular, and the muscle itself. And there's a broad family of diseases that affect all of those different areas. I think a lot of regular people don't have a lot of expertise thinking about, and even a lot of doctors are not always as familiar with conditions involving the nerves and the muscles. So it's something very satisfying when you see somebody who has been a mystery to themselves, a mystery to their other doctors. Neurology is a field for people who like riddles and puzzles and games, and being able to solve the mystery is very, very satisfying.
Let's meet our final panelist, Dr. Rabia Chowdhury, who is board certified in neurology and neuromuscular medicine. Dr. Chowdhury completed her medical degree at Drexel University College of Medicine and her residency at Drexel College of Medicine, Hahnemann University. She went on to complete a fellowship at Massachusetts General Hospital. Dr. Chowdhury is fluent in 4 languages, which helps her build a good rapport with patients of various cultural backgrounds. Dr. Chowdhury, thank you for being here.
It's wonderful to be here. Thank you.
Tell us a little bit about the training that is involved for neurologists and for these individual fields. We hear all of these different schools that you've trained in and residencies and fellowships. Explain a little bit more what goes into this subspecialty in particular.
So first, just going into neurology, we spend a year training in internal medicine, learning about general conditions, cardiology conditions, endocrine conditions, and then we go on to do a 3-year residency in neurology. After that, the 3 of us have done neuromuscular fellowships where we learn about the various diseases that Dr. Lovett had mentioned outside of the brain and the spinal cord. And some of us also go on to do training in doing muscle biopsies or doing nerve testing, including EMG.
Really incredible training, and thank you all for telling us more about your expertise and why you do what you do. Up next, we'll dig deeper into understanding neuromuscular disease. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Complex conditions of the nervous system require extraordinary care. At St. Luke's, it begins with a compassionate team of neurosurgeons with incredible skill sets and advanced level practitioners experienced in caring for patients with conditions of the brain and spine. A neurosurgery visit does not always mean surgery is the only option. And when surgery is the best option, St. Luke's offers minimally invasive neurosurgical approaches. St. Luke's, the neurosurgical care you trust now more than ever.
Hi, my name is Jeff. I've had this disease, chronic inflammatory demyelinating polyneuropathy, since about 2013. It wasn't too hard to walk, but it was getting difficult. But eventually it became quite debilitating. I had muscle weakness in my arms, muscle weakness in my legs. I could not raise my arms above my shoulders, and I ended up in a nursing home for 3 months. I was in a wheelchair, I could barely move, and I worked hard to get out of there. Dr. Rahija is very caring. I feel like we're friends. I mean, that's what it feels like. She knows what I've been through, and as far as treatment goes, the nurses over at the Cancer Center in Bethlehem are just wonderful. They do their best, visit by visit, day by day, to move me on to something better. If we take the lowest point that I was, which is in a wheelchair, barely able to move, to where I am today, it's all St. Luke's. It's Dr. Rahija, it's the nurses, it's the treatment I've had, the care. They've looked after me and they've pushed me along to where I am. My experience with St. Luke's has just been absolutely wonderful.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank you, our viewers, for watching our program tonight and for providing us with questions for our panel, which we'll get to later in the show. Joining me is a talented group of medical professionals, Dr. Devisha Rahija, Dr. Stephen Lovett, and Dr. Rabia Chowdhury. We've learned about their expertise, and now we want to dive a little deeper into neuromuscular disease. All right, so Dr. Chowdhury, I'm going to start with you. There are so many different neurological conditions and neuromuscular conditions specifically, which Dr. Lovett explained a little bit in the first part. What similarities do they share, and what are their most common diseases that you might see? Who does this affect?
So things that will tip us off to neuromuscular disorders are things like weakness, numbness, trouble swallowing, sometimes trouble talking. We love to ask people if they have trouble getting up and down the stairs or doing their hair. That tells us more about what we call proximal muscle weakness, or muscles that are closer to the trunk. Common diseases that we see include myasthenia gravis, peripheral neuropathy, muscular dystrophies, ALS, to just name a few.
Wow, really incredible. Dr. Rahija, I want to ask you about your team and coordinating care. I would imagine with these diagnoses and what you do, there are other medical professionals and other people that need to get involved in the care. How do you coordinate that in the different disciplines within the field of medicine?
Neuromuscular diseases really impact, like Dr. Chowdhury and Dr. Lovett mentioned, nerves and muscles. And as you look at our whole body, heart is a muscle, our respiratory wall muscles are muscles, and diaphragm is muscles. So we coordinate very carefully with our colleagues in pulmonology and cardiology. I've been here at St. Luke's for 5 years, and we have developed great relationships with our colleagues in these subspecialties because we have patients who follow with us and with those specialties too. As we grow further, as our team advances, our goal would be to set up a multidisciplinary clinic for patients with neuromuscular diseases, so we can have one clinic where the patients can see us and our cardiology and pulmonology colleagues.
It's really important to know that for patients and people watching out there, that there's such good coordination and collaboration among the teams. Dr. Lovett, I want to turn to you because I'd like to know, what are some of the contributing factors to neuromuscular disease, and are some of these conditions hereditary?
So there are hereditary conditions that affect the nerve, there are hereditary conditions that affect the muscle, and even a few that affect the neuromuscular junction. They can present at different stages of life. There are some conditions that are genetic that become obvious during childhood, and even though that's, I think, what most people think about, there are conditions that are genetic that don't become obvious until later in life. And there are different things that we look for as neuromuscular specialists that might suggest that. For example, people with certain inherited nerve conditions, they may have very high arches in their feet, they may have scoliosis, they may have a very high arched mouth, their palate, and those aren't things that necessarily people would pick up on, but those are the kinds of things that we're trained to look for.
Dr. Chowdhury, what are some maybe more common but overlooked symptoms as people are watching that they might be experiencing that might be a red flag to say, hey, you know, call a doctor, go to your primary care, get a referral, and seek help? What would be some of those symptoms?
So sometimes eyelid droop may be a signal that someone has a neuromuscular junction problem, like a myasthenia gravis or a myopathy. Shortness of breath can go with so many different conditions, like Dr. Rahija was saying, so that's frequently a tip-off for a neuromuscular disorder.
Dr. Lovett, speaking of signs, how important is early diagnosis in the treatment of nerve and muscle conditions? I mean, does it matter kind of when you seek help, or is early important?
Well, I think it's always been important because people want to know why they have the symptoms that they do. Now, neurology traditionally has had the reputation years ago of being diagnose and adios. It used to be thought that neurology didn't have a lot of treatments. But there have been tremendous changes in the last several decades to where it is now recognized that a lot of the conditions are treatable. And the earlier you can start treatment, usually the better the outcome will be.
It's great to know that neurology and neuromuscular care is coming so far, but Dr. Rahija, I want to ask you about other support. So there's neurological medical care, but what other things should patients who get a diagnosis be seeking that's counseling or other support? Because it sounds like some of these issues can be quite life-changing.
They certainly are. So if you look at patients with neuromuscular diseases, like Dr. Chowdhury mentioned, they come in with weakness and numbness. Balance can be affected. So we work very closely with our team with physical therapists, occupational therapists, how we can assist the patients to gain the function they have lost and how we want to maintain the function as the disease. Some of these diseases are progressive and invariably they do get weaker as the time goes on. So the more active they stay, the better the chances for them staying functional for long periods of time.
It's really incredible. Thank you for explaining to all of us really what a neuromuscular specialist and physician does and what people need to be looking for, but also to know there's help out there. All right, we're not done yet. After the break, we'll learn more about advancements in technology at St. Luke's University Health Network. You're watching St. Luke's Health Now.
St. Luke's has been a cornerstone of the Lehigh Valley for over 150 years. It was originally founded to provide industrial workers with immediate local access to care. In the last century and a half, while healthcare has transformed dramatically, St. Luke's dedicated physicians, employees, and volunteers have proven they can respond to changes with exciting, innovative, and bold healthcare solutions. St. Luke's ability to deliver the highest quality care at the lowest cost is truly transformational and will ensure our future.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have an interesting show for you tonight. We're talking about neuromuscular medicine at St. Luke's University Health Network. In case you're just tuning in, I'm joined by three St. Luke's medical professionals, Dr. Devisha Rahija, Dr. Stephen Lovett, and Dr. Rabia Chowdhury. Thank you all for being here. In the first part of the program, we learned a little bit more about what you do, why you do it, and then you've taught us a little bit about what neuromuscular medicine is and who it affects. Now I'd like to dive in a little deeper and talk about some of the advancements. Dr. Lovett, we talked about electrodiagnostic medicine in your bio. Can you tell us what that is and what are nerve muscle biopsies and how do they help guide the treatment and the diagnosis?
So when we talk about neuromuscular, when we talk about electrodiagnostic medicine, we're generally talking about the performance of EMG and nerve conduction studies. Those are extremely important for us to narrow down the possible things that could be causing the condition. For example, neuropathy is not one specific diagnosis. When somebody says they have neuropathy, that's a little like saying, I have a stomach ache. That is technically true, but that doesn't tell us, is it your gallbladder? Is it your hernia? Is it your reflux? What is the reason? The same way, when someone has neuropathy, then we need to figure out what is the reason for the neuropathy. The EMG and nerve conduction studies tells us a tremendous amount of information about the neuropathy and helps us to very quickly narrow down the list of potential causes. It is also very important in the assessment of muscle conditions to help to understand a little more about how the muscles are affected and what the pattern is, which helped us to figure out potential causes. Nerve and muscle biopsy is a condition that is not commonly performed. In particular, I have not done a nerve biopsy in about 5 years because we have come such a long way in the advances of genetic testing. We used to commonly do nerve biopsies to help us to understand about the type of inherited nerve problem or the type of inherited muscle problem that somebody might have. Now we can diagnose those very commonly with a blood test. Muscle biopsy is more commonly performed. I do about 20 or 30 of them a year. They are very helpful for different conditions in which you need to look under the microscope. Certain inflammatory conditions cannot be diagnosed for certain without a muscle biopsy.
Very interesting. You're talking about these advancements, and Dr. Chowdhury, I want to ask you, what are some of the new therapies that are available to patients with neuromuscular disease, and do they improve symptoms and even disease progression? Do they slow things down?
So we've been very lucky in the last probably 10 years or so with the advent of so many different treatments. So if you think back to ALS, we only had one treatment in 1995 that was FDA approved, that's Riluzole. And it took until 2017 for the FDA approval of Indaravone, which is another treatment. Both of these treatments do provide a modest benefit in survival, but ultimately it's a more devastating disease. But there's definitely ongoing research with ALS, including stem cell transplants and other things. We have an explosion of medications in myasthenia gravis. So myasthenia gravis is named for death myasthenia gravis because 100 years ago or 150 years ago when it was first known, it was a deadly disease. And with the advent of things like steroids and antibiotics, it became more survivable, but now it's become more treatable with the different things that we have. So we have things like eculizumab and efgartigimod and a whole host of new medications that we can use.
Which is really hopeful. However, you mentioned that these can be devastating illnesses. And Dr. Rahija, I want to ask you about the conversations that you need to have with patients, not just the communication, but patient education. I am learning so much here today, so I can only imagine when you find out you have some sort of neuromuscular disease. How do you work with patients on the communication and their education and acceptance of what they're going through?
I think the first part, from a patient standpoint, we all like to listen what the patients are going through from day-to-day basis. And as we come to the diagnosis for the patient, I can speak for most of my colleagues, we all like to explain the patient what is the origin of the disease. Some of these diseases are progressive, some we have cure for, some we have treatments available for, and our goal is to give them the most functional independence we can do by whichever resources we need to pull through. As we explain to the patients, as we set expectations, sometimes these are short-term expectations, and as we progress with them, there are long-term expectations that we work together as a team with me and patients together.
Excellent, really excellent. Dr. Lovett, I want to ask you, you mentioned not really needing to do something like nerve biopsies anymore. Can you tell me a little bit more about how the advancements in this field have really come such a long way over the past couple of decades and what you see on the horizon?
When I was a resident, we had just exited the era where we were learning why people had conditions. It hadn't been so long ago when I was a resident that people weren't sure what myasthenia gravis really was. There had been a lot of controversy over whether it was a disease caused by the immune system or not. Now we are getting far deeper into the origin of a lot of diseases from a genetic standpoint as well as from an autoimmune standpoint. Learning these things not only helps us to understand why people have them, but also how to treat them. Dr. Chowdhury had mentioned about the treatment of people who have Lou Gehrig's disease, and a lot of what we have learned comes from finding people who have genetic cases of Lou Gehrig's disease and learning why that happens and then figuring out about treatments to try to correct that and to apply it to people who don't have the genetic form. So we're really in the middle of a renaissance as far as neurology and neuromuscular disease. things that I never thought I would see in my lifetime.
That's really encouraging, and I know, Dr. Chowdhury, you mentioned a lot of new medications, but I think that one of the things that's so important in medicine are research and clinical trials. Are any of those going on, and things that might really improve therapeutic options for people that are living with neuromuscular disease?
Absolutely. There's so many centers around the country that have clinical trials running, and even independent drug companies that run trials. So there are trials in Lou Gehrig's disease, or ALS, myasthenia gravis, myopathies, pretty much every neuromuscular condition that you can think of.
Dr. Rahija, I want to ask you about medical imaging. That has advanced very far in the last 50 or 60 years. How has that helped your diagnosis and diagnosing people earlier? How are you using imaging?
Medical imaging, MRIs, as came through decades ago, and as the focus of these imaging gets better and better, there are some subtle findings that you can see. Even in Lou Gehrig's patient, there are some findings you can see early on in the disease if we have better imaging available. Nerve and muscle ultrasound is becoming more and more popular in neuromuscular diseases. So like Dr. Lovett said, we do muscle biopsies for patients, and you can identify a muscle which is most affected before we biopsy to increase the yield of a biopsy. And same goes for nerve ultrasound. We can do nerve ultrasound for carpal tunnel, cubital tunnel. These are pinched nerves that helps our surgeons to do minimally invasive procedures as patients go through these issues.
All positive improvements and advancements in this field. Great to hear about it. Thank you all for such an engaging conversation. Up next, questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
St. Luke's has been named a top 50 cardiovascular hospital in the country for the 8th time, and we're in good company. St. Luke's has the only local heart care team to be ranked in the top 50, along with Mayo Clinic and the University of Pennsylvania. This means our heart patients have higher survival rates, fewer readmissions, fewer complications, and better patient experiences. Using the highest quality healthcare standards, no other hospital in the region has better heart care. St. Luke's, the heart care you trust.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation and understanding about neuromuscular disease with St. Luke's University Health Network. Now we're going to get to some of our questions from our viewers. All right, Dr. Chowdhury, I'm going to start with you. This viewer writes, my husband came down with Lyme disease many years ago and recently started to experience muscle weakness. He has been diagnosed with myopathy. Could there be a connection between the two?
Yes, there can be. Lyme disease can cause a myopathy. It's well diagnosed by muscle biopsy, and it's not a frequent complication of Lyme, but it is a known complication.
Interesting to know, and something for people who have had Lyme to keep a watch for. All right, Dr. Lovett, this is for you. Is peripheral neuropathy considered a neuromuscular disease? I was just diagnosed, and I'd like to know more about my treatment options.
So peripheral neuropathy is a neuromuscular disease, but it's not a specific diagnosis. In the United States and in the world, the most common cause of neuropathy is diabetes. The second most common cause of neuropathy in the world, believe it or not, is leprosy. Now, we don't see that very frequently here in the United States, but it does happen. The second most common cause of neuropathy in the United States is alcohol. So when we see somebody who has neuropathy, first of all, we have to establish that's what it is, but then we have to understand what is the reason for the neuropathy. Our history and our examination give us clues. The EMG and nerve conduction studies give us clues, and it helps us to decide what blood tests might be the next step or whether there's other tests to do.
Dr. Rahija, let me ask you this one. My brother died almost 30 years ago from ALS. There were few treatments available to him at the time. What would his options be today if he was just diagnosed?
So like Dr. Chowdhury mentioned, there has been a lot of research in ALS field, and there have been at least 2 or 3 new FDA-approved drugs literally in the last 5 years. Edaravone was FDA-approved in 2017, and there is clear data now and evidence that patients who are on medication, they prolong the lifespan and somewhat slow the progression of the disease. We just got another approval from FDA for ALS last year. Relyvrio has been another medication. It was a result of a huge multi-center trial that showed benefit in ALS patients.
Wonderful to know. Wonderful to know. Dr. Chowdhury, let me ask you this one. I have a family member with a neuromuscular condition. Is there value in finding a support group, even if it's online, to help patients and families cope?
Yes, definitely. I would say that would be very helpful. There's a few different ways that it can help. One is just creating a community of people who have similar problems to help each other, not just the patients, but the families as well. And what's nice about a lot of support groups is frequently they'll have a professional physical therapist or a device representative or a physician or a nurse come to these meetings to give guidance about walkers, wheelchairs, feeding, and various other symptom management.
I think it's always great to seek help, and I know from friends who have gone through things, there are a lot of amazing support groups online as well for people to share their experiences and their successes, so that's great as well. All right, Dr. Lovett, this question is for you. I hope I say this correctly. I hear my myasthenia gravis can affect the eyes and facial muscles and even swallowing. Can you explain this disease and symptoms to look for?
So myasthenia gravis is what's called an autoimmune disease, when the immune system is attacking a piece of the body. If the immune system attacks a piece of the muscle responsible for listening for the signal that comes from the nerve, we call that myasthenia gravis. So if the nerve cannot communicate with the muscle, it would be expected to cause weakness. But in an unusual pattern, myasthenia gravis likes to affect the eyes first. Not always, but commonly. So people may have droopy eyelids. They may have double vision that goes away when they close an eye. If it doesn't start in the eyes, it can be a little more difficult to recognize initially, but it can cause weakness at the tops of the arms and the tops of the legs. It can cause problems with swallowing, with speaking, with breathing. It's one of those conditions that it's important to recognize very quickly, not only because you don't want to delay treatment, but because depending on the muscles that are involved, people can really get into trouble.
All right, Dr. Rahija, this question is for you. Can you explain Charcot-Marie-Tooth disease, and how can it affect the feet and even lead to injuries and infections? So tell us what it is and what are the things you need to be concerned about.
So Charcot-Marie-Tooth disease is an inherited neuropathy. That means it's a genetic problem in your body where the gene which help us form the nerves is affected. Most of these diseases tend to run in families, so patients would come in with multiple family members affected with the disease. More often than not, patients present in early adolescence or sometimes early adulthood, where they would notice that I cannot run as fast as my peers can do. I tend to twist my ankles a lot more than what my friends would do. My feet get tired. And as they grow, as they age, you would start noticing that patients are developing high arches. They're losing the muscle bulk in their feet and their hand muscles.
Before you go, I'd like to ask each one of you what you would like to say to patients out there who might be struggling about this field, its current state and its future. So Dr. Chowdhury, I'll start with you.
So I think it's a very encouraging time. We have so many different treatments coming out for various neuromuscular disorders. And so I think the most important thing is to seek help if you have a problem, and the journey may be complex, but there's a lot more hope than there was a few years ago.
Excellent. Dr. Lovett?
I see a lot of patients who apologize to me for saying, I'm sorry for giving you all these details. I'm sorry to keep going on. And I say to them, I want the long story. It's my job to ask the right questions and to know which are the symptoms that are relevant. Talk with your doctor. Make sure they understand what's going on.
Excellent advice. And Dr. Rahija, what about you?
I agree with both of my colleagues. We highly encourage our patients to come talk to us. If you notice anything progressive, they must be evaluated.
Excellent advice. Don't ignore symptoms and seek help. Thank you all for being here. This was an incredibly informative show. We thank you for that. And thank you to all of you for watching. For more information on neuromuscular medicine at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.